New question. I had just finished breast cancer treatments in July of 2021. Soon after, abdominal pain started, which has gotten progressively worse, bloating, constipation, etc., on my ovary. But my doctor decided to do a laparoscopy, and he said I have endometriosis. I have a history of this many years ago, and I'm 53 years old. My CA 125 was normal. Does that mean everything is okay? Is this test accurate? Is it possible that I have ovarian or endometrial cancer given my history of breast cancer? And this question is coming in from Michelle.
Thank you for giving me the name at the end.
You got it.
Michelle, so my dear, you're 53. So I have a lot of things to say here. Number one, once you've had a laparoscopic evaluation, that is the gold standard for diagnosis. Pretty much CA125 is a moot point, right? You already had the gold standard. A blood test is be a little bit adding some extra information, but you've already had laparoscopic that if your doctor said you didn't have anything serious, then you didn't have anything serious. CA125 being negative is very reassuring. But I have to say, sometimes it's not always elevated. It's only elevated in maybe the majority of ovarian or endometrial cancer, but not always. Reassuring, but not diagnostic. The laparoscopic evaluation is diagnostic. So if they had it and they saw endometriosis, then it probably is endometriosis. So how to evaluate in general pelvic abdominal pain? We start with imaging. I'm sure your doctor started with doing scans, possibly even MRI of the pelvis, and they saw nothing to explain your pain. So then they went to do an exploratory evaluation, which is a camera that goes inside the abdomen and see what's going on. The next thing I want to say is if they see endometriosis, it's typically something that's hormonally driven. These are endometrial tissue outside of the endometrium. Endometrium is the lining of the uterus. So if you have a lining of the uterus, you have this lining that grows before periods, sloughs off with the periods. Again, it starts with this cycle, thickens up, sloughs off with each cycle. When there is endometrial tissue outside of the uterus, that just happens during embryonic, when we're embryos and the development, some random tissues sit somewhere else in the body, and then it can cause this pain with the periods. Every time you have a cycle, you have severe pain. Pain could be coming just from the uterus, but it can be coming from outside of the uterus if there are endometriosis spots outside of there. It could be on the ovaries, could be just on the abdominal wall, on the fallopian tubes. So endometrial tissue in a place where it does not belong would cause a severe pain, but it typically goes with the cycle. Just like the lining of the uterus, it grows and thickens. That's what causes pain outside, and then it sloughs off. Now, outside the uterus, there's no sloughing off, and you get this pain, chronic pain, severe pain. So 53-year-old woman, is she menopausal? If she's menopausal, why is endometriosis now acting out? Endometriosis should go to sleep after menopause in the majority of the cases. It shouldn't start to act out if you're menopausal. Now, sometimes 53 can be borderline. We could be still just in the transition. And sometimes we give aromatase inhibitors in women with breast cancer. I'm very curious to see if Michelle is prescribed a pill for her breast cancer, either Femara or anastrozole or aromacin. These medications are treatments for breast cancer, and they can wake up the ovaries to make hormones again, even if the ovaries have been asleep as a transition from menopause or have been asleep as a reaction to chemo. And then you give aromatase inhibitors, and if woman is not fully menopausal, you can have something similar to a cycle again, because they don't block the ovaries, they block estrogen outside of the ovaries. Then the ovaries say, wait a second, somebody's blocking estrogen, let me make some more, because the ovaries are not completely menopausal. And that can create a cycle, and I've seen this happen. A lot of times we say, well, 50, 52 might be menopausal, and then let's give you aromatase inhibitors for your breast cancer, and then woman starts having a cycle again. So I suspect, I would be definitely suspicious that maybe Michelle is not fully menopausal, and I would suggest getting an FSH level and an estradiol level to see if, are we making hormones again? And that would that lead to endometriosis to start waking up and causing the pain. So that is just what intrigues me about Michelle's story. It's very unusual for endometriosis to show up after menopause unless we're doing something to wake us up. But if nothing related to medications, sometimes doctor would use hormonal treatments to stop the pain, or sometimes it's a surgical thing that they need to scrape off whatever they can see. Again, the treatment has to be coordinated between the gynecologist and the oncologist to make sure if they prescribe any hormone treatments, they are not hurting her if she has hormonally driven breast cancer. So both doctors have to coordinate the care.
That's so interesting. For my own learning, does endometriosis in some of this clinical course typically get managed by the gynecologist, or does an endocrinologist get involved as well?
I know it's called endo, but it's not endocrinology. It's the endometriosis. It's the lining of the uterus. Sometimes endocrinologists can, if it's hormonal craziness going on, but typically it's gynecology.
Yeah, no, I ask not for the name, but because of some of the tests you mentioned that are...
Yes, but sometimes people can confuse because it's called endometriosis. I wanted to clarify. Endocrinologists could be involved if it's related to abnormalities in the hormones that need to be regulated. But really, gynecologists are very good at doing regulating the female hormone as well.
Excellent. Yeah.